Magandang umaga, Filipinas. Good morning. You're watching Eagle News Mornings from Canada. I'm Thomas I. Likeness, reporting from our Eagle News studio in the Western Canadian province of Alberta. My city is Edmonton, and I'm here to bring you news and commentary from across the country. A good Monday morning to you, the start of another work week for many. Let's check the weather this morning in Manila. Expect a morning thunder shower in one or two spots. Otherwise, it's going to be mostly cloudy. Should get up to about 29 degrees today with a real feel of 34. About a 50% chance of precip and drip. You know, that liquid sunshine. Currently, a cloudy sky and 27 degrees. Feels like 33. AccuWeather tells me the air quality is excellent. We'll turn now to the weather map in Canada. And our street scene up there comes from Calgary. This is the Simon Valley Parkway. And we thank JC Umo for this shot. Starting on the west coast, Victoria, mostly cloudy, got up to 10 degrees today. Vancouver had some light rain earlier, also 10 degrees. We go across the mountain eastward to Alberta. Edmonton, mostly sunny and 5. I love it down in Calgary there. Sunshine and 14 degrees. 14 degrees. Saskatchewan, Regina reporting sunshine and 4. Saskatoon, sunny and 1. Winnipeg, sunny and 3. Toronto, partly cloudy and 1. Ottawa, we've got a mix of sun and cloud, -2. Montreal, mostly cloudy. The temperature there is 0. The Atlantic provinces, well, Fredericton reported a mix of rain and snow throughout the day. It got up to about 3 degrees there. Halifax, cloudy with light rain and 5. St. John's, Newfoundland, had light fog throughout the day, drizzle, and a temperature of 4 degrees. And that's a look at the Canadian weather map. And at the top of the news, I want to give you a look at the numbers in Canada. They're not good. The second wave of COVID-19 continues to wash over the country. We've passed the 400,000 mark since the pandemic began last March. Now, more than 100,000 of those new cases, that's 25% of that total. 25% occurring in the last month. So this thing is accelerating. We see more than 6,500 new cases a day in Canada, and we're losing 100 people a day. 100 people a day dying due to COVID-19. So do the math. That works out to 1 death every 15 minutes. Chief Public Health Officer Dr. Teresa Tam says the number of new cases could jump to 10,000 a day by January 1st if the present trend continues. Could go higher if people don't tone down their holiday celebrations. You know, there's a lot of guesswork in Dr. Tam's job. She was asked by reporters how much of the population would have to be vaccinated to achieve herd immunity. Tam says she really doesn't know. You know, there's so much about this virus we just don't know. So much remains a mystery. She says normally if we could get 60 to 70%, hopefully more, if we could get that many immunized, herd immunity can be achieved. But with COVID-19, we just don't know. It might have to be 90%. We don't know. The priority right now, according to Tam, though, is to get the vaccination into the arms of as many people as possible. And with more on that, we turn to Eagle News correspondent Andre Lajoie. He's standing by live this morning in the nation's capital of Ottawa. Good morning, Andre.
Good morning, Tom. How are you? And good morning, everyone.
I'm doing very, very good. Bonjour.
Bonjour, bonjour. Yes, according to the Canada Chief of Public Health Officer Teresa Tam, initial supply of vaccine is expected to become available in early as 2021. As the supply will be limited in Canada, National Advisory Committee on Immunization, or NACI, has released its latest guidelines to recommendations for initial sequencing of key population for early COVID-19 immunization. According to NACI, those recommendations aim to archive Canada's pandemic response goal to minimize serious illness and overall death while minimizing social disruptions as a result of COVID-19 pandemic. And NACI recommends that the initial doses of authorized COVID-19 vaccinations should be offered to residents and staff living in city that provides care for seniors, adults 70 years of age, older, and beginning with the adults of 80 years old and up. Healthcare workers, including those who work in healthcare, and personal support workers who work involved directly in contact with patients, and also indigenous communities where infections can disproportionate consequence. As COVID-19 cases in Canada are increasing, Public Health Agency is tracking a range of epidemiological indicators where the disease is most active, where it is spreading and has an impact on health and Canadians and public health laboratory healthcare capacity. So the government of Canada is investing in made in Canada research, as they already made an advanced purchase agreement of many hundreds of millions of doses in most promising vaccine candidates from around the world. This will give Canadians an access to save the effective vaccine as soon as they are ready. The minister announced that the following the careful review the recommendation of COVID-19 vaccine, as the task force and government of Canada are entered to an agreement with Pfizer and Moderna to secure millions of doses of COVID-19 vaccine candidates. As for now, to date, there are 6,352 cases, a total of 408,921 cases, with an active case of 71,450 and 93 new deaths, in total of 12,589 total deaths. In Ottawa, there are 8,701 confirmed cases and 679 deaths for 384 cases active. In Quebec, there are 1,691 new cases, a total of 151,599, with 24 new deaths, in total of 7,255. Reporting from Capital City and Ottawa, this is André Lajoie. We live in interesting time.
Andre, before you head off this morning, tell me about people's feelings about the vaccine. Are they wanting to be first in line to get it? Are they wanting to wait for a little bit? What are they feeling about it?
It's pretty half and half, I would say, Tom. The majority are waiting to see what will happen, but I would say like a good 60% of people can't wait to receive it. As you know, in Canada, here in Ottawa, Ontario, and Quebec also, we're up in the rise. We're still in the red zone here in Quebec and Ontario. So, yeah, people can't wait to start having the vaccination and see where it goes with that.
You're going to get it?
Yes, definitely. I'm going to get it. As a survivor, also, I had the virus at the beginning, but luckily I didn't have it severe. So I was just on the standby to see if I had it or not, which I had to wait 14 days. But for sure, I'm going to have the vaccination.
Thanks for joining us this morning, Andre, and you take care and stay safe, okay?
Thank you very much, Tom.
We take a look now at what the province of Ontario is planning for the rollout of the vaccination, and we have details on that from Eagle News correspondent April Masong-Song.
With recent news that COVID-19 vaccines are soon to be made available to other countries, a growing curiosity rises as to when and how it will be coming to Canada and to Ontario. The Premier expresses the same concerns and calls on the federal government for answers. Take a look.
There's no reason at all Canada should be last in line. And I've said that before. We need to be lockstep, shoulder to shoulder with all these other countries that are rolling it out. So we aren't controlling the distribution. I'm sorry, we're controlling the distribution. We aren't controlling the procurement side of these vaccines, and we're relying on the federal government to give us some information. And then that goes back to what I keep saying. How much are we getting? You know, what type of vaccines are we getting, and when are we getting it? That's going to play a critical role, and it is concerning. We don't want to be lost in line, and we shouldn't be lost in line.
The Premier has also announced a COVID-19 vaccine task force that will be responsible for the preparation, distribution, and administration of COVID-19 vaccine doses in Ontario. It will be led by former Chief of Defence Staff for Canadian Forces General Rick Hillier. However, as of Thursday, there is still not enough information on who else will be a part of this task force and the specific guidelines it will implement. The Premier has been criticized for the delay in making the plan and the task force members public. Here is the Premier's response.
Well, let's be very clear. The Minister of Health, Solicitor General, and their teams have been working on this for months. When I first met General Hillier, he had an opportunity to sit down with those teams, and he was amazed on how much work they've been doing. They've been working on this for months right now. So have we delayed anything? Absolutely not. Are we going to be announcing the task force? Yes, we are.
When pressed to answer why Ontario's COVID-19 vaccine task force hasn't started earlier and cannot provide more details when other provinces have already done so, this is what Premier Ford had to say.
Well, what I can guarantee the people of Ontario, we will be ready. As sure as I'm standing here, we will be ready. We have a phenomenal team. We have a phenomenal leader with General Hillier leading the charge, per se. And we're ready, we're organized, and as soon as they land on our soil, they'll be shipped out right across the province.
As of Thursday, Ontario reports 1,824 new COVID-19 cases, with 592 in Peel, 396 in Toronto, and 187 in York Region. 14 new deaths are linked to COVID-19, and 203 patients are currently in intensive care, which crosses the threshold of 150 patients in the ICU for when other surgeries and procedures are to be delayed or cancelled in order to accommodate the rising number of incoming COVID-19 cases in hospitals. At the time of this feature's airing, the Ontario government announced 9 members of the COVID-19 Vaccine Distribution Task Force. Their inaugural meeting was held Friday, and they exercised a run-through on the distribution of the first 100,000 doses. In Toronto, April Masong, Eagle News. We live in interesting times.
Here in Alberta, anti-mask protesters flooding the streets of downtown Edmonton and Calgary again. They were out in full force yesterday in a repeat of last Saturday. Several hundred demonstrators showed up in Calgary to protest public health measures. Same thing in Edmonton. Calgary Mayor Naheed Nenshi, well, he's just not impressed at all with these people.
Don't do stuff that puts people at risk. It's self-indulgence. It's luxurious, and we don't have the luxury for that right now. It's deeply, deeply selfish. And I don't got time for selfishness. I don't have time to indulge people like this. Our job is to keep everyone safe. And as Chief Neufeld very aptly put it, you hate the rules, write the Premier. Write me. Don't go out there and barge into shops and put other people's safety at risk. Don't have time for it. We're not in a world where we can indulge that kind of selfish behavior. Simple as that. And I know that the government of Alberta feels exactly the same way.
Tinfoil hat gang on hand for these rallies presenting a variety of conspiracy theories. Police say they'll go after the organizers of the events. They face $1,200 fines. That's 45,000 pesos. Outdoor gatherings in Alberta are limited to no more than 10 people. Alberta Premier Jason Kenney says he's also sick and tired of the misinformation. And Kenney had this message for people who think the pandemic is a hoax.
You don't think it's real, talk to my friend Jay in Northeast Calgary, who was in intensive care fighting for his life for nearly 2 months. A man who is not elderly and didn't have serious preconditions, but was on a ventilator for weeks and I believe was in a coma for much of that time.
Currently, Alberta has the highest number of active cases in Canada at more than 18,000. In the last 7 days, COVID-19 has killed more than 63 people in the province, or about 1 every 2.5 hours. That's no hoax. Those numbers are real. I'm going to give the last word on this to Alberta's Chief Medical Officer of Health, Dr. Dina Hinshaw.
Home and bending the curve. not the rules. You were sparing someone from the worry of watching a loved one battle COVID-19. You might even spare them the pain and loss of losing someone to the virus.
That advice, stay home, in these times, it applies worldwide. Still to come, we'll hear from our good friend Alfred Asenis, the news analyst from Hawaii. And if you're just joining us, it's 7:16, coming up to 7:17. You're watching Eagle News Mornings from Canada.
The search for the best continues. Tagisan ng Galing Part 2 is now accepting audition entries. Kung ikaw ay 21 to 59 years old at may angking galing sa pagsayaw, mapasolo, duo o grupo man, magpadala na ng audition entry. Narito ang mga guidelines. Para makapagpasa ng entry sa dancing category, contact Shing at 0995-880-8004. Ito na ang pagkakataon mo para maging tagisan ng galing grand winner at manalo ng 2 million pesos. Para sa karagdagang impormasyon, i-like ang Tagisan ng Galing Facebook page. Kaya sali na!
It says the best defense is still containment.
We are in uncharted territory.
My level volume 450. If I want to 100%. Standing by. Suctioning.
This is Eagle News Mornings from Canada. I'm Thomas I. Likeness. 19 minutes past 7 o'clock and 27 degrees under cloudy skies in Metro this morning. Well, we're going to tell you about a different kind of an epidemic. To avoid any confusion, an epidemic is confined to one geographic area as opposed to what we're going through now, a pandemic, which is worldwide. So a little over a year ago, the independent state of Samoa in the South Pacific suffered a huge measles outbreak. More than 80 people died. Why is this relevant today? Well, the state of Hawaii is trying to learn from that experience, particularly when vaccinations were being administered to the population. Joining us live from Honolulu, Hawaii this morning, Alfred Asenis. Aloha and good morning, my friend.
Aloha, Thomas, and to our viewers in Asia, Australia, and good day in other parts of the world. If I recall, Tom, on your part of the world, all the greenscape, the greenery is fading because of the season. Ours here is still on hold, and I'll keep it on hold for you. This is one of the botanical gardens out here in central Oahu, and just letting everyone know that this and other parks are still open under a tiered strategy here in the city county of Honolulu. Now, you mentioned the epidemic in independent Samoa. Now, a year ago, actually it started in October when the first cases of measles were reported. And it wasn't until late November when things got out of hand, and sadly, up to 83 lives in independent Samoa out of a population of about 200,000+, 83 lives were lost. Now, given that, the state of Hawaii, particularly our Lieutenant Governor, Josh Green, set up a mission, a medical mission with 80 medical professionals, and that's the scene there in the independent Samoa. They went to the state of Samoa, and within 48 hours, he and his team administered nearly 34,000 vaccinations against the measles. Now, there were also other partners from the international community, and I think there were some private partners too in the South Pacific island nation. So what's in discussion right now at the state level, Thomas, is they're drawing lessons learned as far as how the state government will be able to set itself up, to be successful in administering the vaccines. Once the vaccines against COVID-19 are approved by the federal government, and how everything's going to be scheduled and who gets first priority. So that's what's in focus right now with the lieutenant governor taking the lead, because he has now the firsthand experience on being able to manage a wide-scale vaccination. Now, in other reports, if I remember correctly, we're looking at probably sometime later this December for, if all goes hunky-dory, all goes well, through the federal government, we can have the vaccine, sometime this month. But just like in other parts of the world, the first priority goes to our medical workers. So they get the first dibs, so that they can have the protection they need to get vaccinated. Now, for us in the general population, given everything, the timeline that we know of right now, we're looking at probably in the springtime, March, April, thereabouts. So if we were to, for a takeaway, for our audience, as far as some expectations about this vaccine, until we get the vaccinated, guess what, folks? The mask has to stay. So don't ditch that mask yet, and continue to exercise these safety precautions, until such time that the public safety and the government officials announce otherwise. So that's the latest that we have, and we are monitoring closely this developing situation on what the way ahead is here for the state of Hawaii. Thomas?
Quickly, Alfred, are people anxious about the vaccine? Are they ready to get into line?
Well, again, it's there is some anticipation, and right now the latest plan is to have our medical personnel get the protection they need and get vaccinated. And of course, given this time of year, it's a busy season. We continue to reopen. Oh, by the way, Thomas, I think there's some resumption of flights coming out of Canada. I think Vancouver and Calgary. That's going to start, later this month, if I recall, Thomas.
Yeah, they're starting. Air Canada is doing some pre-flight testing for COVID. So that's going to get your tourism industry going, and hopefully people stay safe.
That's right, Thomas. Last time I was tracking, I think the flights out of Vancouver will resume on the 17th, and then out of Calgary will be on the 18th. So you never know, Thomas. Hey, got the little botanical garden here waiting for you.
Sooner, hopefully it's sooner than later that we're over there. Thanks for joining us this morning, Alfred, and stay safe. Consumer debt in Canada is rising. On average, households in Canada have $1.77 in debt for every dollar earned. Now, according to Equifax, it's a credit reporting agency, consumer debt rose 3.3% from the same time a year earlier. How much does the average person owe? Sitting down? $75,000. Collectively, you add up everybody's debt in Canada, more than $2 trillion. What's driving the increase? Car loans. That was one of the biggest factors. Because of the pandemic, manufacturers were disrupted, prices went up, and when you take that lack of supply and increase in demand, prices go up, so the average car loan increased to its highest level in 4 years. Home mortgages, another factor. With those record low interest rates, people have been rushing into home ownership. I've never seen interest rates this low. I remember when I bought my first house, I thought I got a deal, 13%. Now, less than 2%. Oh, one other factor driving this, credit card spending almost at pre-COVID levels. And with the December holidays coming up, we can expect people to be giving their credit cards a good workout before the year ends. Now, whether this spiraling debt is manageable remains to be seen. You know, despite shaky job security in some sectors because of the increasing restrictions and lockdowns, despite all of that, people are still borrowing. We're going to turn to sports now. Another exciting backcourt tandem has been formed in the NBA. Russell Westbrook continues his magical career with the Washington Wizards. You know, he's got the opportunity now to play alongside All-Star guard Bradley Beal and his former coach with the Oklahoma City Thunder, Scott Brooks. EBC sports reporter Tenny Samagi has the details.
Russell Westbrook spoke to media on Saturday for the first time since being traded from the Houston Rockets. The All-Star is excited to be playing in the backcourt with Bradley Beal, plus he reunites with Scott Brooks, his coach during his first 7 years with the Oklahoma City Thunder.
Man, I'm super excited about it, man. Brad is superstar talent, and he proved that and showed that last year with what he had, and he's just only going to get better. My job is to come in and continue to uplift him, try to push him to be better, and that's all I'm here for, man. And I'm happy to be a you know, his counterpart and try to make the game easier for him, and that's what I'm trying to do. I mean, obviously there's some differences. I'm a little older. Scotty's a little older. You know, we had some time and apart, but the great thing about me and Scotty's relationships, we always stay connected. We always been in contact throughout my whole career. Scotty was, you know, a huge part of the reason why I'm able to do some of the things I'm able to do now. To this day, he gave me a chance. He gave me an opportunity to go out and make silly mistakes. Some of the mistakes I still make today. But he allowed me to do that, and I'm grateful for that because I learned so much about myself, about my game, about who I am as a player, and I'm just happy and excited to kind of be back with him and continue our obviously our friendship, but also our journey on the basketball court as well.
Brody and Beal will make their debut as the Wizards play their season opener on December 23rd. In New York, Tenny Samagi, Eagle News, we live in interesting times.
That's our program for today, and I just want to say, despite all of the high numbers, bad news, and so on, don't be discouraged. I wish you all good health. Take care of others. Take care of yourselves. Stay home. Stay safe. Most of all, stay tuned to Eagle News for accurate and balanced coverage of COVID-19 pandemic and other current affairs. In Edmonton, Canada, Thomas I. Likeness, Eagle News. We live in interesting times. Stay tuned for Kid Cuento.